Good afternoon. We have some good news today, announcements, but today we want to extend our condolences to the people of Beirut and Lebanon as a whole. They have been dealing with most difficult circumstances, hunger, economic difficulties, and now this unbelievable explosion that's injured thousands and taken many lives. I know our hearts are, I can say, we're with the people of Lebanon today. With that said, today I'm joined with John Weisman and DSHS Secretary Cheryl Strange and Assistant Secretary Bill Moss to talk about our Safe Start plan for long-term care facilities. You know, we know that the COVID pandemic has had a disproportionate impact on Washingtonians who are living in our long-term care facilities. And that's not just on how the COVID itself has affected the physical health of our residents. In the spring, by necessity, we implemented restrictions on long-term care facilities, which included restrictions on visitations. And that was obviously necessary because the risk was too great to the health of the residents as the pandemic was raging. These are highly susceptible people with very vulnerable conditions. And we, I believe, rightfully acted to protect them from the transmission that can only be done by limiting the contact with people, particularly with those from outside of the facility. So those were necessary decisions. They were the right decisions, but they're very difficult decisions. Difficult because that has meant isolation for folks now for months. It's meant families who've missed their loved ones on Mother's Day. They've missed Father's Day. They've missed seeing their friends and their relatives. And this has been extremely difficult for people in these facilities. That's why I'm very pleased today to say that we have come far enough, both in our restraint of the pandemic and in our ability to develop protocols that will work to continue to protect the physical health of our residents while giving them much greater contact with their loved ones in visitation in many, many contexts. So the upshot of what we will announce today will mean more grandmothers visiting their grandchildren. It'll mean more fathers visiting their sons. It'll mean more friends getting together. And I think that's going to mean real joy for people. And I think it's going to be really good for the mental health of residents. It's going to mean people have what they enjoy most in life, which is to see the people that they love. And this is good not just for the people in long-term care, but for their relatives as well, because they're just as impacted as the inability to see their loved ones in the long-term care facilities. So today is a big step forward for our state, and we hope one of many. So today we're talking about our Safe Start plan for long-term care. And what this is it's a phased approach as we continue to beat down the pandemic, and it's based on the level of activity, basically, and the ability to protect people as we go forward. So our phased plan for reopening these facilities to visitation is not the same as our state Safe Start plan for opening our counties. It has some similar nomenclature, but it's different. And it has 4 phases that are specific to the long-term care facilities themselves. I just want to say that at the outset. As we move forward through the phases of our long-term care facilities, those don't necessarily sync up with the term phases for our counties. I just want to make sure that's clear at the outset. So this is just one part of what should be considered in the criteria for starting activities at long-term care facilities. And this will take place, be in effect next week. Here's some of the highlights of what is going to be allowed. In the first phase, which is essentially all of the long-term care facilities at the moment, it's going to allow compassionate care visits, window visits, remote visits, and I would say maybe best of all, outdoor visits that are limited to 2 a day. And we're really happy about this because it's going to allow people to visit their loved ones in right now in very good weather and a very safe outdoor seating and social distancing, and enjoy the fruits of those relationships. As conditions improve, both in the community and into the facility itself, that'll be in phase 2. And in phase 2, these activities are allowed with additional options for indoor visits in limited circumstances. And in phase 3, there's a somewhat higher but still limited number of visits that could take place. Outdoor visits would still be preferred, and this is just a reminder that we still have to be cautious with this virus, even as we limit its spread. Now in phase 4, which is our ultimate goal, would we return to normal visitation protocols? Now, when we are in phase 4, of course, we're still going to need to maintain our requirements regarding testing guidance for staff and residents. Now, these are only several aspects of the plan which cover some of the activities, and Cheryl will talk about the more specific criteria a little bit later on. In order to move forward in these phases, the long-term care facilities will also have to go 28 days without a resident or staff member testing positive for COVID-19. These facilities must also have at least a 14-day supply of PPE on hand. So, to qualify for these phases, it's based both on the conditions in the facility involving the lack of these of the incidence of positive cases. But it's also, they need to know the key metrics of the county within which they reside. Areas with higher disease transmission rates would keep a facility at an earlier phase, even if the other criteria is met. So it's a two-track or two doors you have to walk through, essentially, to move to the next phase. So some of the policies that keep everyone safe, of course, will remain regardless of what phase the facility qualifies for. And that means, and this goes for all of us, social distancing, masking, and screening for individuals for symptoms, to name a few of what's going on in long-term care facilities. Now, we know we'd love nothing more than just jump back to normal today and not have to worry about the spread of COVID-19. But we know that this virus is still with us. It is extremely active, and we know we're acting outside of these facilities to take care of folks inside by wearing masks. So we need to continue to be thoughtful and deliberate, obviously. We need to be conscious of the devastating impacts that what we do outside in these facilities can impact what happens inside. And I'm serious when I say that I hope people, the next time they think about going to a big party where they're going to hang around with 20 or 30 people, not wearing masks and standing shoulder to shoulder and breathing on each other, I hope you'll think of the lives that would cost of people that you love who might be in a long-term care facility, or yourself for that matter. So with that, I will turn it over to John Weisman.
Thank you, Governor Inslee. Appreciate that. As of August 4th, there have been 5,694 cases associated with long-term care facilities, that is COVID cases, and 894 deaths statewide associated with long-term care facilities. Now that's 10% of the total cases and about 56% of the total deaths in our state. I do want to be really clear that these are associated with, they could be employees, staff, visitors, but we can't be sure that they necessarily got these at a long-term care facility for all of those, because they've had many places they've been, but we know they were associated somehow at a long-term care facility. So looking at these data, it is clear that our elderly population are particularly vulnerable to COVID-19, and we need to be very cautious when adjusting these restrictions of long-term care facilities. We've definitely kept that in mind while developing this plan, and are balancing the safety and long-term care residents with their needs for social support. The department has been working hard to provide support for these facilities to ensure that they have the tools and the knowledge they need to keep residents safe. Since the pandemic began, Department of Health infection preventionists have worked with local health jurisdictions to complete almost 400 technical assistance consultations with long-term care facilities to help keep people safe. As we implement this plan, we will continue to work with DSHS, local health, and facilities to support the safety and well-being of long-term care residents in our state. So in closing, I would just like to remind everyone that we all, as the governor was saying, have a responsibility to protect the most vulnerable people in our communities. Just as our schools are not islands, neither are our long-term care facilities. We can't relax restrictions safely until community transmission is low. What we do individually matters collectively. Fewer, shorter, and safer interactions are crucial. Each of us can do that by limiting our activity, staying home as much as possible, keeping physical distance from others, and wearing a face cover. If we do that, we can be successful. Thanks, Governor, and back to you.
All right, Cheryl.
Thank you, Governor. Good afternoon, everyone. Shortly after Washington experienced the nation's first outbreak at Life Care Center in Kirkland, the governor made a very difficult decision, but a necessary one, to prohibit visitors at the state's roughly 4,000 long-term care facilities. And as was the case in the rest of the country, long-term care facilities quickly became the epicenters of the pandemic. And as of today, more than 500 facilities in the state of Washington have reported COVID-19 cases among residents or staff. And as you heard Secretary Weisman say, they accounted for more than 800 deaths being associated with those, which was roughly a little less than 60% of the state's total. And those have occurred in these facilities. Some families have had to endure the unthinkable, saying goodbye to loved ones on virtual platforms like FaceTime or Zoom, instead of being there at the bedside, holding the hands of their loved ones. But still, the toll would have been undoubtedly much greater without restricting those visitations and implementing other emergency measures. As the agency responsible for regulating long-term care facilities, the difficult decision to restrict visitors also bought DSHS time. Our investigators fanned out across the state and visited every one of those 4,000 facilities to conduct infection control surveys. They made sure the facilities were properly screening employees for COVID-19 symptoms before every shift, that facilities were diligently practicing proper hand hygiene and isolating residents who tested positive for COVID-19. That's more than 200 nursing homes, 500 assisted living facilities, and over 3,000 adult family homes. We have also spent the past few months working diligently with families, advocates, stakeholders, and our partners at the Department of Health to craft this phased reopening plan. It's designed to keep Washingtonians that are highly susceptible to this virus safe and healthy during the pandemic, while providing them with much needed quality of time with their loved ones. This plan, as Governor Inslee said, will mirror the governor's Safe Start plan. But I want to be clear that there are additional criteria that a long-term care facility must meet before advancing to the phase that the particular county they reside in is in. So, in addition to long-term care facilities being in line with their county phase, the facility must be able to have access to consistent testing for residents and staff. In addition to that, it has to have gone 28 days without a positive test in the facility. And the facility must have at least 14-day supply of personal protective equipment on hand. So regardless of what phase it is in, facilities must continue to practice social distancing, universal masking, and continued screening of residents and staff until this public health crisis is over. I'd like to just take a minute and thank the thousands, and I want to repeat that, thousands of families who have had a loved one in a long-term care facility. I want to thank you for your patience and your understanding over the past 5 months. We know this has been very, very difficult for you. We all look forward to the eventual return to normalcy in these facilities and believe this phased-in approach is really the first step of making that happen. So, Governor, I want to thank you for that, and I will turn it back to you, and when we're ready to go through the details, we can do some of that.
You bet, Cheryl. Thanks for your staff. Thanks for the people in these long-term care facilities that have been creative to care for our loved ones. We appreciate that. I do hope that our discussion of the restrictions doesn't camouflage. This is a day of opening. This is a joyous celebration, in my view, of families being able to be together again. And frankly, there's nothing better in our lives than to be together with our families. And this is a big step forward, I think, for the state. Because with these new protocols, we are able to simultaneously care for our emotional bonds with our family, but also to protect people physically. And I'm confident we can do both with these new protocols. We've learned enough to do it. We've demonstrated our dedication to these residents, and I know people want to move in this direction. Before I stand for your questions, I want to make another comment. Today is the 55th anniversary of our nation's Voting Rights Act, and it's clearly one of the most important pieces of legislation to perfect our union. And we know that that's true because securing rights to vote are absolutely fundamental to democracy. We know that has not been the case for communities of color and other marginalized communities over the decades. And unfortunately, there is a new assault on the right to vote in our country. It started with the Supreme Court gutting of key elements of the Voting Rights Act. And since then, we've seen more states adopt restrictive policies that are designed to reduce the access to the ballot. Now, those are other states. Fortunately, that has not happened in the state of Washington. But an injury to the voting rights of people in Alabama or Texas or anywhere else for that matter is an injury to our citizens as well, because we're all part of that national democracy. It is our rights that are being violated by the diminution and the gutting of the Voting Rights Act. And today, unfortunately, we have a president who's really fixated on using the pandemic to deny the people of the right to vote. And that's really sad to have to say. It's really not hyperbolic to look at those who want to suppress the right to vote, to deny the franchise. And, you know, it's sort of an extension of what happened in earlier Jim Crow eras. So our nation needs to restore the Voting Rights Act. We need to do everything we can in the meantime to ensure that every voter can effectively vote, whether in person or by mail. And we hope that across the country that voice will succeed. Now, I do want to say, too, that Washington State is a beacon of light in this regard because we have demonstrated to the country that an open, accessible, efficient, legitimate, all-mail ballot works. And the president's lies about our voting system are just that, and they're unacceptable, and they should not stand. Both Republicans and Democrats in our state have recognized this, and we ought to make sure that Washington State leads the nation as we have in so many other cases. We've shown mail-in ballot votes, it works, and we hope the nation will embrace it, rather than to allow the suppression of the vote that is so insidious going on across this nation right now. With that, happy to stand for your questions.
First question comes from Sally with AP.
Hi, thank you for taking the call. It's Sally Ho from the AP. It was noted that 60% of all deaths in Washington State are people associated with long-term care facilities. Are there any projections, have there been any projections made in your process of coming up with this framework to open, looking at, you know, how this reopening will affect the death numbers? In other words, do you expect more deaths or a higher percentage of deaths associated with long-term care facilities once this moves into more phases and more visitors?
Absolutely not. And the reason is we have very carefully calibrated this to assure protections against transmission in these centers. I think you'll see that there are multiple protections that are still in existence for residents in all of the phases, particularly starting with insisting in phase 1 that we do this outdoors, that we limit the indoor numbers, that we insist on social distancing, masking, testing. And I should reiterate that all of the protocols that were previously in existence regarding hygiene, in effect, are continuing into existence. So I'm very confident that we're in the sweet spot of restoring the relationships and the joy of family at the same time providing the same level of protection to these residents.
Sally, would you like to ask a follow-up?
Yeah, Governor, can you talk about, what we learned from Kirkland that is being applied here? How do we avoid another kind of Kirkland outbreak?
Cheryl, would you like to address that?
Can you hear me all right?
Yeah, go ahead. We lost the first words, but.
Yeah, thank you. I think we've learned a lot from what happened in Kirkland. One of the things that we know is that we're working on is being ready as a state to address a pandemic or a statewide infection, and being prepared with the right amount of personal protective equipment, our ability to test, our ability to track and monitor data and drive through science. Specifically with Kirkland, what we learned is the transmission happened quickly. The facility somebody brought that COVID into that facility, so we learned a lot about the transmission that occurs outside of the facility by staff coming into the facility. We had to learn about testing, and those NPIs, those non-pharmaceutical interventions became very clear. We did a lot in terms of monitoring infection control. It is something we monitor and regulate and enforce always throughout the state of Washington in these facilities, not just because of COVID, but before COVID, it was influenza, and we still have that threat as well with influenza. So being as prepared as possible was a very big lesson for us going forward.
This is John. I just want to add, even at the time with Kirkland, we weren't aware that COVID was really circulating in the community. There were very few cases, and so folks weren't recognizing something there until multiple people were really ill and in the hospital. So we've learned a lot since then. As Cheryl said, we're very aware now of the virus. Everybody in our long-term care facilities has been trained in infection control. We've got procedures in place. So much has changed since that time, and we're at a much better place.
If I can add too, that looking at it from the macro scale, the science has improved so dramatically since those early days. We have learned so much about the transmission, including the fact that this is an extremely transmittable infection through different means of transmission, not just droplets. It's one of the reasons we've learned that masks are effective, that they really work. We've learned about the transmission system that can be blocked to some degree by masks. And we believe that these have already shown early promise to reduce the transmission rate. So this is like many things. As we've learned, we've got more successful, smarter, and more resilient. And we're doing that today. And I'm very happy about the progress we're making today.
Next question comes from Joe with the Seattle Times.
Hi, question for either of the secretaries. As recently as June, the state was unable to hit its own benchmarks for testing nursing homes and memory care units. What makes you more optimistic at this point that you can roll out rapid tests if you need to, if there's a suspected outbreak, and what plans are in place to do that, to make sure facilities can get quick testing right now?
Well, I can start, and Cheryl, you can add in. So first of all, we have actual supplies now of swabs, which back in those earlier days, that was incredibly challenged. So we have supplies. They've been distributed out to local health departments and others for rapid distribution. So we have that. We are also, working on continuing to test more of the staff and residents at facilities. And the federal government is helping to provide some point of care testing as well. So the systems are getting more developed. But again, I think the key here is that we've got the supplies. We can quickly get those to facilities that need them. And we've got staff and facilities now who are monitoring residents every single day for any symptoms suggestive of COVID. And as the governor said, as the science has progressed, we've learned more about those symptoms, and those symptoms are broader than we initially thought, and sometimes can look a bit different in our elderly. So armed with all of that information, we are at a much stronger place at this point in time.
Joe, I'll just follow up on John's comments. The way we know we can do this is we are doing it. We have done it. We have completed our testing for nursing facilities, our first go around. And as John said, we're getting some supplies from the federal government. We've gotten most of our supplies in state here through the Department of Health and other local health jurisdictions. But we have tested over 20,000. I'm looking at raw numbers here. Over 200, I believe 215 nursing homes with 20,000 plus individuals in those. Those tests have been completed. The first test, there will be parameters and monitoring closely for outbreaks or any kind of indication that will be testing again, and the federal government is also looking at their protocols for that. Also, 545 assisted living facilities with 34,000 clients in them. Dr. Teresa Fatinos, the leader of that team, working very closely with DSHS on the regulatory as well as the program side and facilities. We are getting that testing done, and it continues. We're very aggressive with it. We have had some quick turnaround in getting those done. So I think we're on that path and continue to work on that path. We have a long way to go. We have a lot of people. We have over 72,000 people in long-term care facilities, and some big, some small. We're starting with nursing homes, which is complete, and assisted living with memory care units, which are the highest risk. So we're working our way through it, Joe.
I add too, in the first several months, the reason this testing could not take place is that the president refused both Republican and Democratic governors' requests to use the Defense Production Act to require the production of the testing kits and the testing supplies that were necessary to do the testing. And that was very, very unfortunate. Finally, they have been dragooned into doing that. As a result, we've had some improvement in our test kit supplies. But those were lost months, and it was very unfortunate and very, frankly, angering to Republican and Democratic governors alike.
Yeah, follow-up for Secretary Strange. Just to confirm, the original round of testing in nursing homes and memory care units is complete. And is there a plan to do other rounds of mass testing of that like that in the future as a precaution?
Joe, the nursing home facility testing is complete. We are in process with assisted living with memory care, and Bill Moss can speak to that if I'm misspeaking, Bill. And Joe, what was the second part of the question?
See value, or are you planning on doing similar rounds of sort of testing every facility in the future just as a precautionary measure?
Yes, we are planning on testing. There are multiple protocols and guidelines associated with those. Bill Moss, could I ask you to jump in on that question as to where we are with long-term care testing?
Sure. Can you hear me?
Yes.
Okay. As Charlotte said, we have completed all the testing for all staff and residents in nursing homes, assisted living with memory care, and are in process right now with the remainder of assisted living facilities. Once that's done, we are looking at, once we've completed let me back up. We are looking at right now what the frequency level and the number of people that we should be looking at testing in nursing facilities and assisted living. I don't think it would be what we did the first time, which is test everybody. I think we'd be looking at testing a portion of people, and we do think there's value to that. The other thing I would say about the visitation plan or the Safe Start plan is that if we have an outbreak in a facility, the facility would be working with the local health jurisdictions, and the local health jurisdiction would be making some determinations on what type of testing or how much testing needed to occur related to that particular outbreak. So we've got a plan for at least some level of frequency of testing in facilities, even though it's beyond the initial everybody gets tested piece of it, and then certainly a plan for facilities to be connected with local health jurisdictions around potential outbreaks and those kinds of things. So those plans are in the works. I would say in terms of assisted living facilities in general that we hope to have all our test everybody, residents and staff, completed by mid-September.
Next question comes from Essex with Cairo 7.
Yes, Governor. The new model from the folks at the University of Washington out this morning is projecting that the state of Washington will have to reimpose closures like non-essential business closures, stay-at-home orders based on the current rates of infection. We'll have to reimpose those in October. When you hear that, what do you think? Are you going to ultimately, in a few months, going to have to reimpose some of the closures we had in the spring?
I certainly hope not, and I certainly hope that our masking initiative will continue to succeed. These questions will be answered by what we all do as Washingtonians in the next several weeks. We do have the ability to prevent that from happening, and by doing some really simple, costless things, which are to wear a mask, which is to not go to social gatherings where you're close to people, particularly inside, without wearing masks, to continue not to, to simply avoid conditions where we cause transmission. And all of us can play a role in that. And the more of us who are part of that effort, the less likely such an outcome in October or later would be necessary. Now, these are some projections. I've not had a chance to look at that particular model yet this morning, but all of these things are models and projections. Some of the projections were that we would be to, just 0 or 1 infection by, I think, early June, and I never thought that was the case, frankly. And I would not think that this is somehow baked in at this moment. I don't think there's anything that would suggest that an outcome like that in October is baked in. But the risk of that increases dramatically every time there is a party at somebody's house and people are there without wearing masks and they're talking to each other really closely. And that is a big, big risk for us right now. What we are seeing is that we think a lot of this transmission that is now going on is in social settings. And so I just want to reiterate the power of individuals to control our own group destiny here. And I'm really hopeful people will help out. Now, I want to thank people who are wearing masks big time in retail establishments. We're seeing huge compliance with our order regarding masking. I really appreciate people doing that. But we need to do it in our social settings as well to avoid being too close to people indoors, particularly too long, or outdoors when you're really close to people who are not in your household. So I hope everybody's going to help us out here.
Essex, would you like to ask a follow-up?
Yes, Governor. Yesterday, you came up very strongly telling school districts to avoid in-person education this fall. Yet at the same time today, you're saying that people can go visit folks at nursing homes? How do you help the public understand that what seems to be the picture here?
Well, our Washington public is really smart, and it's one of the most literate groups in America and scientifically literate, and I'm sure they can understand the difference of 25 children in a classroom for 6 hours, running around rubbing noses together in one context, which we need to avoid, in the situation we're allowing today, which is one grandmother meeting her 2 children 6 feet away outside, everybody wearing masks and washing their hands. And that's very, very different circumstances. So I'm confident the public can understand that difference.
Next question comes from Jim with the Spokesman Review.
Yes, Governor, I'm told that in Spokane County, long-term care facilities are responsible for many of our biggest outbreak situations. So I'm wondering, do we know in the state, are these outbreaks in long-term care facilities primarily a result of infections being brought in by visitors or spread from staff?
John, do you want to answer that?
Sure. So thanks for that question. Thanks for that question. This is John. Indeed, sort of as I said in my opening remarks, like schools aren't islands, neither are long-term care facilities. And the infections that we're seeing now are really being brought in primarily, we think, by staff and actually not knowingly. About 30 to 50% of these sort of cases of transmission can occur before anybody even has symptoms. And that's why sort of when we look at community rates, the higher the rates are in the community, and we have staff who live in community and are interacting, they can pick up the virus there and then be infected. And as I said, they may not have developed symptoms yet, but you can spread this 2 days before developing symptoms. So that's why all of these procedures that are put in place are so important. There's universal masking happening in facilities to help prevent this. And we just need to do what we're all talking about, and that is each of us taking responsibility to help bring down these infection numbers in our community so we can avoid this.
Cheryl, did you want to add to that?
Thank you, Governor. Thank you, John. Yeah, I would just add that, as the regulatory agency, as all of us are watching, we are have many, many dashboards in which we are watching. We're looking at disease prevalence. We're looking at positivity rates of testing. These we are in there. Our regulatory arm of DSHS is in these facilities constantly. Eyes on them. We're watching. We track this daily. Facilities are required by regulation to report any change, any positive new staff, any positive new resident, any suspected new resident or staff. So we watch those very closely. And again, I just want to go back to the reminder that just because a county is in a particular phase, it does not mean that that long-term care facility that might have an outbreak is able to be in the same phase, right? So you have to jump through a lot of hoops in addition to being in the same phase your county is in to allow less restrictions. So we're watching this daily.
Can I add something? Thanks, John and Cheryl. I want to add something in part to Essex's question about why we are making a recommendation about the closure of schools at the same time we're allowing more visitation in long-term care facilities. And the reason we're doing it in this, the reason we've looked at it, we've tried to make scientific decisions that are based on science as to the specific circumstances with the specific data at the right moment, rather than ideological statements of broad brush. And I want to show you something that would suggest our approach is having some success. I'd like to show you a graph that shows the infection rate per 100,000, the new infections on a daily basis per 100,000 of population in our 50 states. And in orange is where Washington State is. To the left is the highest numbers. I think it's either Louisiana or Nevada in this particular chart. So this basically compares our infection rate on a relative basis per capita across the 50 states. As of yesterday, we were, I think, either 35th or 36th in the percentage of Washingtonians that had a diagnosed positive test. And I just want to make some comments about our relative position on that. Now, in this case, you want to be number 50, right? So you want to have the lowest number you can. We don't want to be number on this. We want to be number one. We want to be number 50. At the moment, we're 35 or 36. I just want to point this out is we have had relative success here relative to some of our sister states because we have made very flexible decisions based on the science as we receive them, and we're willing to change based on that science. And frankly, some other states have been unwilling to change their protocols, and as a result, they've had some major expansions of the pandemic. So we're having some relative success because of the kind of decisions we're making in the state of Washington. Now, obviously, the people who are responsible for that are Washingtonians. There are people who are wearing masks today. There are people who are social distancing. But there's another thing I want to point out about where we are in that chart. Virtually all of the countries who've tried to reopen their schools have had lower infection rates than we are today, lower than that level in that orange bar. So I would just suggest the way we're going about this is having relative success. We want to continue that approach. We understand that, you know, this could explode tomorrow. There's no certainty of this. And we want to take the steps that will prevent that from happening. We still don't believe we're under an R0 of 1. That means that even though we're in a relatively good position, 35 out of 50, the pandemic is still growing. So we continue to have some work to do.
Jeremy, do you want to ask a follow-up?
Yeah, just briefly on the long-term care spread from staff. Is this because there's a lack of proper training, or is there a lack of PPE, or how do you attribute that?
Again, I think part of this is infections in community, and this is about all of us needing to work to keep the infections down, and that's the challenge. You know, and I think some of this, again, is people can transmit this before they even are feeling ill. And that's why it's so important that we really pay 100% attention to our hygiene, to wearing face coverings, to minimizing our interactions with others. And, you know, some of these infections may also be coming from residents who have been out for some service they had to get and became infected. You know, it's hard to pinpoint each of these. But the point is that at this point, the number of outbreaks in long-term care facilities has gone way down, that the science that's being implemented, the infection control that's being put into place is taking effect and working. And it's something we got to work on every single day. As Cheryl said, they look at these numbers, we look at these numbers every day, and they're tracking facilities, and the speed now with which we identify a case and can immediately isolate people is also why we're having more success. The more quickly we can identify and implement control measures in a facility, that leads to success.
Jim, could I add something to that? I've had some conversations in the past about why we just, you know, can't provide absolute protection to vulnerable people like are in long-term care facilities. And it's extremely difficult. The only way really to do it is to have zero physical interaction of anybody from outside. That means you have to have all of your staff live in the long-term care facility and never go home to visit their relatives. And that just isn't really, we can't just create bubbles like the NBA has, frankly. It's just not practical. So as long as there's significant transmission going on outside the long-term care facilities, it is extremely difficult to guarantee one staffer will not get the disease, have no symptoms, have no fever, wash their hands, do everything right, and still go into the long-term care facility and infect someone. And until we can create bubbles, that's a risk, but we've minimized it as much as humanly possible.
Next question comes from Keith with Kama.
Governor and Secretary, get things clear. So starting on Monday, is every nursing home in phase 1? So outdoor visits can start on Monday?
Yes. I'm sorry, I've just been given some expert advice here. There is an application, so each group has to apply and show their compliance with the protocols that are previously required.
I also think, just to confirm if I heard right, it's also Wednesday, I think, August 12th, that this would start. Is that right, Cheryl?
I believe so, John. I don't have that right in front of me.
Keith, would you like to ask a follow-up?
Let's get clarity. Could you help us get clarity on this mic right now?
Oh, I've had it confirmed that it's Wednesday.
Keith, would you like to ask a follow-up?
Yes, it's the federal regulators are asking that nursing home long-term care facilities be tested once every week, and the federal government was supposed to be sending the instant test kits. Where does that stand?
John?
So what I can say is, and Cheryl can also add in, the federal government has started sending some of these antigen testing equipment to some facilities, and they're prioritizing where they send those to those, I think, with like current outbreaks, et cetera. The list that I saw for Washington has just a few of those on in the first shipment. And so like much other stuff, these sort of supplies coming from the federal government are slower in coming than I think than anyone wants to have happen. So that's what I know. And Cheryl, I don't know if you've got more information.
No, John, I mean, they're sending them all across the United States with facilities that are high need, and some are trickling into us.
We have time for just a few more questions. Next comes from Alexis with the News Tribune.
I'm wondering how many long-term care facilities have that 14-day supply of PPE right now? Is it all of them or most of them?
Cheryl?
Yeah, I would, Governor, if I could ask Bill Moss to answer that question. He is tracking that daily.
Yeah, so this is Bill. I would say the majority of nursing homes would have that 14-day supply. We haven't looked at the assisted living facility side of this, but again, I think the supply of PPE is much better than it certainly was in April, March and April, and much more available today. I think that facilities also have had a preview of the plan and understand that the 14-day supply is going to be required. So if they were a little under that, I'm sure if they haven't already taken steps, are taking steps to make sure they do have a 14-day supply.
Alexis, would you like to ask a follow-up?
Yes, I'm wondering if anyone can talk a bit more specifically about what sort of community transmission rates would keep a facility from advancing, even if they meet the other criteria.
John, I could.
Cheryl, like you were going to go ahead. I'll follow you if I've got other info.
Yeah, so really, you know, there's each phase is assigned high, moderate, medium. So for phase one, for a facility to be able to be in phase one, obviously it's less than 75 cases per 100,000 for 2 weeks. A moderate, which would take us into phase two, would be cases of less than between 25 and 75 per 100,000. Need to stay in that range for 2 weeks, and then minimum for phase three would be less than 10 and between 10 and 25. John, is that?
Yeah. So so phase four is less than 10, and sort of that's what you were implying. And then phase three is from 10 to 25. And this is cases in a community per 100,000 residents over 14 days, much like what we've been talking for everything else. So again, in phase one, anything over 75 cases. In phase two, 25 to 75. Phase three, 10 to 25. And phase four, less than 10.
We have time for one more question. We go to Jerry with the Everett Herald.
Thank you. That information just made me realize that I'm not sure that anyone's going to understand how this process really starts. Can you explain, Secretary Strange or Secretary Weissman, on August 12th, must the facility apply, and how long will it take to get an answer? And then there's so many counties, 25 counties, where it's over 75 cases. Does that just mean that they should just realize their long-term care facilities are not going to get out of phase one for a while?
I will say that come Wednesday, what will happen is people will start with that key metric, which is, remember, you cannot be higher in a long-term care facility, your phase, than the current county is. So the county has to be within parameters of their phase. Then from there, the next question that gets answered is your testing. Do you have the ability to have consistent testing and testing supplies for all residents and staff? And you have to go 28 days without a positive test in the facility. And then you have to have a 14-day supply of PPE. So this is truly a very facility-specific plan. It is a complex plan. It is over 70 pages. And we have been working and training facilities over the past several days. We've worked on protocols, and we will have those documents available as the governor's proclamation gets signed. Those documents will be made available. Again, facilities have been participating in the development of them along with the Department of Health. So it's not automatic that visitation just gets opened wide up, as you saw from that first chart the governor showed.
Jerry, would you like to ask a follow-up?
Just a clarification and a different question, but does a 28-day clock start Wednesday? I think there'd be a lot of families want to know, can they make plans a week from now to visit? And it sounds like it may actually be a month from now when it's clear for each facility. And I just want to make that clear.
If you can show you've been free 28 days, that should qualify. So, but we just need to get the application in. I believe it will be fairly promptly turnaround time. It doesn't require, I don't believe, an inspection. They're yes or no questions. We think it'll be a relatively rapid processing of the applications.
Any final words, Governor?
No, except that I just am very happy that we've made progress in Washington State. And this is an important place to make progress, where we can be with our loved ones, our most vulnerable, the wisest amongst us, which are folks who've been around for a few years. And this is going to mean so much to people, and it's going to be the thing closest to their hearts. And I'm really happy that we're able to do this. And we're able to do this because we have done some smart things in our state. We are masking up. We have made early decisions to try to keep this curve down. And our joint effort means more people who have a chance to see the people they love. I think that's a pretty good thing for a state to do, and we're doing it. So I want to congratulate people for allowing us to take this step forward, and let's continue it. So let's wash our hands, let's mask up, and enjoy our relatives. Thank you.